This video is going to be on Botox for sagging necks. So everyone is bothered by turkey neck. This video is filmed just a little bit after Thanksgiving, so this is a rather appropriate timing. I probably have a little bit of a turkey neck. I got to be careful on this video camera here. But anyways, Botox is actually very effective for early neck sagging. The gold standard is clearly a face and neck lift, which in my hands is a very fast recovery, about 7 to 10 days, very natural, incisions are very well hidden. So I don't want any kind of misunderstanding that Botox used for sagging necks is going to be equivalent or as good as what a neck and facelift would do. But not everyone wants a facelift or a neck lift for a variety of reasons, whether it be recovery, fear, cost, whatever it may be. And a consultation with me we'll talk about more in detail when you're with me, whether you're appropriate for one or the other. So how does Botox in the neck work? Essentially what it does is that there's a muscle called the platysma. The platysma muscle is the little vertical separations you see when in someone that's beginning to age in their 40s and 50s and 60s, where it looks like two bands. That is what Botox targets. And the way it works essentially is that the platysma muscle is in continuity with a layer called the SMAS, superficial muscular apparatic system. That's a mouthful, but essentially what that is a fascial layer. Fascia is connective tissue that comes down into this platysmal region, and that whole area is one network of muscle. So what I do is I inject the platysmal region, which really doesn't serve very much purpose, so there's really not much of an issue with injecting this area. I've not had complications or issues with injecting this. You will Google that you could have a week of issues swallowing or speech, and I've just not seen that. It's a very, very safe injection. I do this probably 2 or 3 times a day, 5 days a week. So it's in my hands, it's very, very safe and effective. So when you inject the lower portion, the SMAS pulls upwards. So it's like a tug of war. And very similar in analogy to the upper face. Like for example, if I Botox the glabella, which is a pull down muscle, and the frontalis is now in opposition, it will pull by itself up because the net pull down is blocked. So when you block one, the other pulls up. So essentially how Botox in the neck works is when you inject the lower sagging portion, the other continuity of the muscle then pull it upwards. Now that sounds like this huge dramatic pull, and it absolutely is not that way. It's much more subtle. So I don't want someone to come in and say, Dr. Lamb, I saw your video on Botox for neck treatments and I'm expecting a facelift off this. It won't happen. But one thing, so the candidates that I think are really good are as follows. Number one, someone that doesn't have sag but has like hyperkinetic muscle. For example, an athlete, if they're straining as they're lifting weights, they can have muscles that are too strong. That is a no-brainer. That will absolutely work extremely well for that individual. And that's really not treating sagging neck, it's treating the opposite. It's a hyperkinetic banding or muscle. I want to interject one thing I just remembered. I've had some patients come in and say, you know, I do neck exercise to make my muscles better, and so therefore I get them tighter. That's absolutely false. The more muscle you pull down here, the saggier it is, because remember, this is a pull down muscle. So you don't want to be engaging these activities to try to strengthen these muscles. I'm trying to weaken them with Botox. So it's no intuitive sense to actually strengthen them through some kind of exercise. So getting back to this whole idea, is a second candidate is someone with early neck banding. So let's say someone in their 30s, 40s, and sometimes even 50s and 60s, but majority are in their 30s, 40s, majority 40s that just have a little bit of sagging. They say, look, I'm not ready for a facelift. I want to do something that makes me look good. So that is a great candidate. Someone that has moderate to severe, they can still do it. They just need to expect less of a result when I do that, but it can still treat it. When it's very severe, I just say, please, let's do a neck lift. And I really try to walk you through that process and say, look, a neck lift is not as bad as you think it is. You don't get a pulled look and bad, ugly scars and hair loss, which is very common stigmata of bad facelift surgeries. But if someone's really sagging, you're going to get a very modest result with this. The other thing that's important is, just like Botox of the upper face, if you're a patient of mine who's been receiving that, you can see that after a year or two, you get significant improvement in the upper face wrinkles, even the point where if you waited a year or two, you almost never get back those bad wrinkles you had before, which is really other videos we've shot and we will continue to shoot regarding that. But my point of this is that repeated Botox neck injections provide you the benefit of ongoing improvement, ongoing prevention. So if I can leave you with one thought, is even though I don't think the Botox will eliminate all this, it will give you an ability to prevent further aging in a very measurable way. I see my patients after about a year of treatment. We do this about every 3 months at a very modest expense. I see that their necks actually improve if they're in the early to moderate range. If they're severe, it's going to be a modest gain, but if they're early to moderate, they oftentimes get a very good result. Now I want to delineate in the neck sort of the types of pathologies, or in other words, the types of things going on in the neck that you may be confused when I say these two vertical bands. You come and say, Dr. Lamb, I got this double chin, like I have one right there, boom. I want to have that fixed with Botox. Well, Botox is going to do very little for that. If you're early, on the younger age, and you've got a little extra fat, then liposuction, which is a surgical option, or Kybella, which is a non-surgical dissolving, permanent dissolving, can work very well for you. So Kybella is not meant for someone with a sagging neck, but Kybella can help with extra fat in the neck area. Not in the jowl, that's unsafe, but in the neck area. I would encourage you to look at my website to go into more of the written detail about how Kybella can be effective for you. So double chin Kybella, early banding or hyperkinetic vertical lines that are sagging like the muscle, not wrinkles, that's going to be more of a treatment using Botox. Now, if you've got sort of saggy, loose skin, again, a facelift is your best bet, but if you've got sort of the wrinkles and things like that, then Sculptra is what I really use. And I haven't shot a video on that yet, but I'm going to shoot that sometime, discussing how Sculptra works for sort of wrinkles in the décolleté and neck area. So I really want to make that separation out from facelift, liposuction, Kybella, Botox, and light lasers and Sculptra. I know it's very confusing, and that's why an in-person consultation really sort out some of the details. But I hope this basic idea that Botox is a preventative and a treatment for early to moderate neck banding, and if you're wondering what can I do to get that safely done and I don't want a neck lift yet, this is a very effective method that I do several times a day.